So, ma'am, could you please tell us, the listeners of Radio Charminar and the people of Telangana, what is lumpy virus actually?
Lumpy skin disease is caused by lumpy skin disease virus. It is a family of pox viridae virus and also genus Capripox virus. Mainly the disease is characterized by the fever and also multiple form of circumscribed skin nodules that is 2 to 5 centimeters in size, enlarged lymph nodes and edema of the limbs and also dewlap, and reduction in the milk production is also there in this disease. And also it's a host specific, and the causes of the disease is mainly occurs in cattle only, and also sometimes buffalo also affected, but the severity is not much is there.
So, ma'am, what are the symptoms of this lumpy virus? Could you please tell us?
Yeah. The main clinical signs occur is that incubation period in between the 14 to 14 days, 4 to 14 days, and even up to sometimes 28 days also the disease will stay. And also LSD signs, how it appear, it looks like it's a very in severe diseases, the fever may exceed 41 degrees centigrade. And also the cutaneous nodules, that is previously I told, that is circumscribed nodules like 2 to 5 centimeters nodules develop, particularly on the head and neck, limbs, udder, genitalia and perineum within the 48 hours of the onset of the disease. The nodules mainly round, raised and involve the skin, subcutaneous tissues and sometimes even the underlying muscles also. The nodules either may regress or progress for necrosis. Ulcers and finally scars we will see in the scars. Large nodules may become necrotic, eventually fibrotic and persist for several months. The scars may remain indefinitely, may or may not subside. Small nodules may resolve spontaneously without consequences. Marked reduction of milk yield in lactating cattle is we were seeing that one. And also rhinitis and also conjunctivitis from some enlarged superficial lymph nodes also we can see. And also vesicles, erosions and ulcers may develop in the mucous membrane of the mouth and elementary tract of the trachea and lungs. Limbs and other ventral parts of the body such as dewlap, brisket, scrotum and vulva may be edematous, causing the animal to be reluctant to move. So the bulls may become permanently or temporarily infertile. Pregnant cows may abort and be in anesthesia conditions for several months.
So, in this condition, can we consume milk of a cow or a buffalo? Because this something which is people are in great doubt because we have seen a lot of cases in Gujarat, Madhya Pradesh that a lot of cows have died, and so is it safe to consume milk and milk product in such conditions?
Nothing will happen because it is not a zoonotic disease, but is an exotic disease and categorized in the list A disease of OIE standards. So we should not fear that take to milk. Have to consume. Nothing will happen.
Okay. So, ma'am, so any vaccines which have been assigned by the government for this kind of disease?
Yeah. During the year 2019 and 20, here first case was recorded in Hyderabad. At that moment, Government of India has given guidelines that goat pox vaccine in bovines, that is in suspected LSD cases, it can be utilized. And also that is the Uttarkasi strain. It can be given to the bovines. If bovines means white cattle and buffalo also, because both cattle and buffaloes are both are in the same same place. At that time, buffaloes also affected, but the occurrence is very less. So we had to separate that buffaloes and cattle. At that moment, if buffaloes, even though affected, some light symptoms will arise. If we can give the antibiotics like that, the disease will subside. The cows more above 4 months of age can be vaccinated. Only unaffected animals can be vaccinated, because affected animals in the same flock, we should not be given that vaccine. We have to separate, we have to isolate that animals. The total vaccine is available in 100 doses of one vial. That goat pox vaccine vial to be diluted, that vial should be diluted in 100 ml of chilled normal saline, and it can be administer 1 ml of vaccine to each animal subcutaneous route. Ensure that the dose should contain. Somebody will asking the question, Madam, this is goat pox vaccine, it has given to the goat, but how should you use in that bovines? Bovines also that same capripox disease virus family, so that we have to give in that vaccine to bovines also. In bovines and both goat and bovines, you have to give in the same dose, that is 1 ml. In 1 ml dose of that vaccine contains 10 to the power of 3 TCID 50 goat pox vaccine. So this vaccination can be given on the 1 ml only to even cattle also. So vaccination can be given at the neck region, especially have to give the neck region also. Ring vaccination of the animals in and around the 5 kilometer radius from the epicenter of LSD outbreaks should be carried out, because once the disease occur in some flock, just to have to separate that all animals and kept in a separate place, and we have to give the vaccination in and around the 3 to 5 kilometers radius only. So when you have to give the vaccination, and we have to maintain the cold chain, because the vaccine should be kept in cold conditions, cold storage only. At that time the vaccine will it will work effectively. So at the time of vaccinations, we have to change the needles every time, so that vaccination could be effectively work.
Ma'am, how one can recognize that this disease is looking like lumpy virus? Because people who are into this cows and everything, who are in milk production and everything, they can't identify correctly that, okay, this is lumpy virus. So how they can rectify, okay, this is lumpy virus exactly?
Because mainly the disease can transmit mainly through the vectors, arthropod vectors. This is the season, so many flies, mosquitoes, biting flies, and also male ticks. At that time, the ticks will effectively working on the animal's body. So that when you see that animals on that animal body, I have to recognize that the animals, the disease will occur through that vectors. So have to control that ticks also. So the transmission mainly through the mosquitoes. That's why in humans also these days we are getting that dengue fever, like that. That also that is also occurs this cattle. So we have to separate mainly, have to isolate the animals. In that case, we can follow that.
Okay. So whom should one consult if the cows or buffaloes, if they are going through lumpy virus, whom they should go and they should consult about all these things?
Preferably we have to, first one case is identified in that village, the farmer should approach the veterinarian and have to explain the disease. Our animals are suffering like that. First the animals, if suffer, fever will be that 41 degrees centigrades, and also slowly after that fever subsides, then lumps will start on that skin. So that basing on that, the farmers will identify and tell to the veterinarians.
Okay. Ma'am, we have a lot of doubt in this whenever people who are into consuming milk products, even they also consume meat as well from that. So people have a kind of fear among them that is this going to develop any kind of serious effect in our body, or we have we too have to take some vaccine. So is any human trials or going on any virus like just like COVID vaccine we have seen Covaxin or Covishield. So do we have any kind of human trial going on this?
Not like that so far, because if the animal affected that disease, people won't take that meat. They won't. If the skin appears like some lumps, and also that animal becoming very late, very weak, and also these all symptoms shows that in our area some anti-mortem and postmortem the diagnosis also going on. In the animal, if you take that animal into the slaughterhouse, they won't allow our doctors. So anyhow, these type of animals should not slaughtered. If the disease is severe, and also sometimes cows will affect, they will also died. So at that moment, the animal should be buried, and should not be open that one carcass. So at that the animal died, we have to use some disinfectants, like you can use that disinfectant, and that animal should be buried.
Exactly. Ma'am, how much government of Telangana is very much looking towards this disease, and they are providing some needs to the people who can be educated and can be aware about this kind of thing. So what is the help from the Telangana government for this?
So far, this is the Veterinary Biological Research Institute. We have produced the vaccines, that is for goat pox, which can be utilized for the lumpy skin disease. So far, we have produced 33 lakh doses of vaccine.
Oh, wow.
So in that, we have supplied not only Telangana. So far, Telangana has supplied 10 lakh doses of vaccine. And also we have supplied to other states, like nearer state like Andhra Pradesh. We have supplied 20 lakh doses we have supplied, and also other states like Odisha and Punjab also have given. So many people are coming forward to take that vaccine. So we are in future also, now we are producing 44 lakh doses in further also. That can also be supplied to our after meeting the demand of the Telangana farmers, and also whatever the vaccine is available, some we have to supply other states also. Now we are going to producing that vaccine.
Ma'am, any subsidies in the vaccines for this?
No, this vaccine is free government vaccine, government institution have to supply free. But for Andhra Pradesh, that is previously total is on bifurcation. They went away to Vijayawada. For that still up to 10th schedule, we have to supply on cost basis to them.
Okay. So, ma'am, what you are going to say to the farmers who are engaged themselves into cow production and all these kinds of milk products, and like what are you going to say to them, because they have kind of fear in their mind regarding lumpy virus?
Mainly the prevention and control is very important. Mainly I would like to tell to all farmers is awareness campaigns also we are conducting in different districts. So immediate isolation, say whatever the sick animal is there, have to separate from the infected animals. So any suspected of febrile nodular skin diseases there, should not be introduced into the unaffected holding the farm. So farmers regularly they are watching and see that any temperatures of the animals are there or any skin lumps are there identified, they have immediately rushed to the inform to the veterinarians. So vector control is very very important. These vector population in the affected areas should be reduced by using of repellents to minimize the mechanical transmission of the LSD. So we have to restrict the movement of the animals from affected areas to free areas. So the trade of the live cattle and participation of the fairs, shows should be banned immediately upon confirmation of the disease in the affected areas. Cattle markets located within the 10 kilometers radius of the epicenter of the infected should be closed. So thorough cleaning of the shed with the disinfectants of the affected personnel or premises, contaminated environment including vehicles plying through the affected animal should also holding should be carried out. Approximately 20% of ether and also 2% of the phenol, formalin 1%, sodium hypochlorite 2 to 3% should be utilized. So previously I told that discard of the carcass of the LSD affected animals should be very much important. In this case, morbidity is 10 to 15% is there and mortality is only 1%. So we have to take the precautions when the disease occurs. We have to give the antipyretics and also paracetamol like injections and also anti-inflammatory drugs. So in this moment the animal suffering with some nodules in mouth also. At that moment they have given some gruel like fluids and also salines. That can be sufficient to that infected animals.
So, ma'am, what you going to give information to the general public about the lumpy virus, because this was for the farmers. So, what will be the message from your side to the general public about this?
So, nothing could be worried about the milk what we have taken, and also it is not a zoonotic disease. The farmers mainly they have to aware what the disease occurs, and also they have to contact with the veterinarians. Immediately go to the hospital and they have to inform to the doctors. And also nothing will happen. If the disease occurs, we have to segregate the animals, and also vaccine is available. So farmers should not be fear about that disease.
Okay. So, ma'am, I hope whatever things you have said, people will listen to this and they will think about, okay, this is not a very dangerous disease. We have solutions for this, we have vaccines for this, we have medicines for this, and Telangana government is with us, and you are, ma'am, you are with us. And thank you so much, ma'am, for giving your valuable time to Radio Charminar 107.8 FM.
Thank you so much.
ओके तो दोस्तों ये थे हमारे साथ इस वक्त मौजूद थी CH मल्लेश्वरी मैम, जॉइंट डायरेक्टर मेट्रोलॉजी बायोलॉजिकल रिसर्च इंस्टीट्यूट की जॉइंट डायरेक्टर हैं, और इन्होंने बताया लंपी वायरस के बारे में। और उम्मीद करते हैं जितने भी किसान भाई हैं और जितने भी हमारे जनरल पब्लिक है, जो हमारे जो समाईन हैं, उन्होंने इस बात को समझा होगा कि लंपी वायरस के बारे में हम कुछ कर सकते हैं। दवाई मौजूद है, वैक्सीन मौजूद है, और इसमें डरने की बात नहीं है। अगर आपके जानवर को भी लंपी वायरस अगर ग्रस्त हो जाता है तो उसके लिए हमारी जो मेट्रोलॉजी बायोलॉजिकल रिसर्च इंस्टीट्यूट मौजूद है, जहां पर वैक्सीन्स मौजूद है, और ये फ्री ऑफ कॉस्ट है दोस्तों। 1 रुपया भी आपको लगाना नहीं पड़ेगा, इसके लिए फ्री ऑफ कॉस्ट है। और तेलंगाना की सरकार पूरी कोशिश कर रही है कि आपकी जो जानवर है वो ग्रस्त ना हो जाए इस लंपी वायरस का। तो दोस्तों बहुत बहुत शुक्रिया, आपने अपना कीमती वक्त दिया इस प्रोग्राम के लिए, और सुनते रहिए रेडियो चारमीनार 107.8 FM, दिल से हैदराबादी।